Kirsty and I are really happy to be here today. We hope to take you through what's been a fairly significant year in policy terms for acquired brain injury, as well as providing some details about the campaigns we've run across the organisation. There is a fair bit to cover, so it will be a bit of a whistle-stop tour, but we'll do our absolute best to avoid any really irritating jargon, which this area can be littered with fairly often. And as Tamsin said, there'll be some questions at the end, so we're happy to answer anything that we may be able to at that point. So probably the most significant ongoing development this year in the field of acquired brain injury is the acquired brain injury strategy. And according to the government, this is designed to improve experiences and outcomes for people who live with acquired brain injury by outlining what services of survivors of acquired brain injury and their families should expect from public services, including health and care services. That's a bit of a mouthful, but that's what the government says the strategy is designed to do. And Headway's parliamentary champion, Sir Chris Bryant, led a campaign to secure the strategy back in 2021. And the picture you can see on the screen there shows him outside Downing Street with other interested MPs and charity leaders with draft copies of what was then his ABI bill. And in late 2021, the then Prime Minister, Boris Johnson, committed the government to developing a cross-departmental strategy for acquired brain injury. And the Department for Health and Social Care launched a call for evidence back in March 2022. And since then, Headway has worked closely with civil servants tasked with drafting the strategy. And importantly for us, we supported those living with the effects of acquired brain injury to share their thoughts and vision for what a strategy could and should look like. Sadly, the strategy is yet to be published, with constant delays due to churn at the department, both at ministerial level and civil service level. But in the recent reshuffle, a new minister was appointed, and Andrew Stevenson MP, and we have written to him to ensure we keep ABI high on the political agenda. But in good news, one of our other parliamentary champions, Sir John Hayes MP, asked a parliamentary question last month about what steps the government is taking around the issue of ABI. And happily, the new minister reconfirmed the government's intention to publish a strategy in the new year. So Headway will absolutely play our part in holding them to that and hoping that the strategy will be the best it possibly can be for survivors and their loved ones. Now, whilst it's great news that we will have an ABI strategy at some point in the new year, we at Headway feel that in order for it to have the truly transformative impact we all want to see, it needs to be appropriately funded. So as well as the often devastating impact on the individuals and those close to them, brain injury costs the UK economy an estimated £15 billion each and every year across multiple government departments. Therefore, twice this year, we have run the Budget for Brain Injury campaign, calling on the Chancellor in both his budgets to set aside much needed funds for brain injury survivors and the services important to them. Vital services like those delivered by the network of Headway groups across the country, which provide specialist community-based rehabilitation services to survivors and their loved ones. Now, we know that effective interventions as early as possible after brain injury improve individuals' rehabilitation and recovery chances. Providing services at this early stage also prevents people from requiring more costly state-funded services in the long term. Hence, it makes economic sense to invest early in services too. And we're not the only ones who think so. We launched the campaign with charity partners from BrainKind, the Child Brain Injury Trust and UKBIF, and the support we got from the community was incredible. Thousands of people signed pledge cards to support the campaign, and we spread the word far and wide across social media. Despite the Chancellor not including ABI in his budgets this year, to our dismay, we continue to make the case at the very highest level that this funding is essential and badly needed for those living with acquired brain injury and their loved ones.
We'd like to talk now about some of the broader social and policy issues which will have an impact on brain injury survivors and their loved ones. And one of the most pressing issues of the last 2 years has been the cost of living crisis. Well, we know that the crisis is having a significant impact on the people we support, as well as on the Headway network. And the challenges caused by the pandemic have been compounded by ongoing financial difficulties for many people. Earlier this year, we undertook a survey of the Headway network to ascertain the scale of the impact for them and for the survivors and carers they support. And the results were stark, with groups suggesting that their clients would be at risk of homelessness, offending, arrest, or possibly even suicide if the group's services were no longer available to survivors who are presenting with ever more complex needs. According to the survey, if Headway groups didn't provide services, up to 70% of their service users would present for more costly state-funded support. So the services provided across the Headway network are not only morally imperative, but financially beneficial both to local and central government. The community-based rehabilitation services provided by Headway groups are vital to those who access them, and they'll be an important pillar in helping to deliver the government's acquired brain injury strategy once it's published. Our cost of living report, based on what the Headway network told us, was delivered to the Department of Health and Social Care to support our call for greater government funding for ABI survivors and for the networks that support them. Another development in the health policy landscape in England has been the promised publication of a major conditions strategy. The strategy will cover the following conditions: cancer, cardiovascular disease, including stroke and diabetes, musculoskeletal disorders, mental ill health, dementia, and respiratory diseases. So the ABI strategy, with its focus on one condition, albeit one that covers a vast spectrum of different needs, is now an outlier. We wait to see how the major conditions strategy will interact with the ABI strategy and whether there'll be any synergy between them. And we have suggested to the DHSC that they should be cognizant of the aims and objectives of each other. Previously, strategies on individual conditions and diseases had been promised by the government. However, in January this year, the then Health Secretary announced a different approach, with a move away from single disease strategies to the one major condition strategy, with a focus on prevention and early detection and treatment of diseases, alongside better long-term management. The aim of the major condition strategy is to improve outcomes and better meet the needs of the population, who are increasingly living with more complex comorbidities. The government published an interim policy paper in August this year, ahead of the publication of the strategy, which is due in early 2024. We will continue to remind the Department of Health and Social Care that it will be important that the ABI strategy and the major conditions strategy are reflective of each other's aims and ambitions, and that sufficient funding needs to be attached to both.
Now, moving on to social security, the government's health and disability white paper was published in March this year and represents a pretty significant shake-up of the benefits assessment system. These proposals were built on in both the Chancellor's spring budget in March and the autumn statement in November. There have been a series of announcements over a period of 18 months around this issue, and until the proposals are put into practice, the impacts remain unclear. However, the government suggested that the paper's contents would ensure disabled people and people with health conditions live the independent and fulfilling lives they deserve. The changes announced in the paper that will have an impact on brain injury survivors in the future included, firstly, scrapping the work capability assessment so that there is only one health and disability assessment, that being personal independence payments assessments. This will need a change in the law to come into effect, which the government says it will not be able to table before the next Parliament, therefore certainly not coming into force before 2025. Secondly, expanding work coach support to assist people with health conditions to move into work. And thirdly, trialling specialist assessors with condition-specific knowledge to undertake benefits assessments. Headway called for this in our Right First Time campaign, and we met with brain injury survivors and the then Minister, Justin Tomlinson, to lobby him directly about these proposals. So we were really pleased to see them included in the white paper, and we keep a close eye on developments there. More recently, in November's autumn statement, the Chancellor revealed further details about proposals for what he called the Back to Work plan. This is a package of measures designed to reduce the number of people on long-term ill health benefits and includes changes to the work capability assessment before it's eventually scrapped. And these changes make it more likely that people will be assessed as able to prepare for work. They also make it more likely that people will be subject to work-related conditions. The changes will only apply to new claimants or those being reassessed. Headway strongly opposed the changes in our consultation response, not least because the effects of brain injury are hidden and complex and regularly misunderstood. But Kirsty will fill you in a bit more on that and the other consultation responses later. Alongside the changes to the work capability assessment, details about a new chance to work guarantee were announced. And this applies to existing claimants who have been found to have limited capability for work and work-related activity, and guarantees they will not be reassessed if they try to work and it doesn't work out, in an attempt to encourage more people into work. Overall, a pretty significant raft of changes, but it's important to note they will not come into effect before 2025, and only new claims from that point will be affected.
In June, NHS England revealed its long-anticipated workforce plan, which outlines the future of staffing in the NHS over the next 15 years. The plan suggested there would be a doubling of training places for doctors and almost the same for nurses. However, sadly, there was no commitment to address the chronic shortage of neurorehabilitation professionals in the NHS system. Headway has repeatedly called for more neuro-rehab professionals, in particular neuropsychologists. The plan cites a lack of available data as a reason for the absence of specialist workforce planning, and this is particularly frustrating for us as we consider that improved data collection in the NHS in relation to ABI is urgently needed, and we've campaigned for such for 2 decades. However, the commitment to updating the plan every 2 years gives us hope that neurological expertise could be factored in, particularly following the anticipated publication of the ABI strategy next year. Similar workforce plans for Scotland and Wales were published in March 2022 and January 2023, respectively. Now, Headway often responds to consultations from the government and related bodies about issues that affect brain injury survivors and their families and carers to ensure that their needs are considered by those making policy decisions. And we'd like to tell you about some of the consultations we've responded to this year and why it's important for survivors that Headway gets involved. In July, we responded to the railway company's consultation on proposed train station ticket office closures. We understand the negative impacts that these proposals could have on brain injury survivors, and we asked survivors, carers, and ABI professionals to send us their views, which we submitted as part of our consultation response. We strongly opposed the proposal to close the ticket offices and told railway companies that many brain injury survivors would find it difficult or impossible to travel if the offices were to close. We asked the railway companies to reconsider their proposals and consider the needs of brain injury survivors when accessing train travel. In late October, the government announced that proposals to close the ticket offices had been scrapped, news that will bring relief to many survivors and their families. We're still shocked that the proposals ever saw the light of day, and we hope that the overwhelming response to the consultation from brain injury survivors and charities like Headway has demonstrated that the voices of disabled people must be heard and taken seriously. In September, we responded to a government consultation on a proposed disability action plan. This was a broad consultation seeking views on a range of different issues, and we responded to those we thought would have the most impact on brain injury survivors and where we felt our voice would be heard. This included expressing the needs of survivors in relation to climate change adaptations and mitigations. For example, access issues regarding pedestrianised zones in towns and cities and access to electric vehicle charging. We also considered the needs of survivors in relation to emergency planning, for example, power outages, and how these might affect essential electric supplies for hoists and wheelchairs and ventilators. We also considered the needs of survivors in relation to accessing assistive technology and greater support for disabled parents. And we also thought about access to elected office, how brain injury survivors could be supported to run for positions of responsibility, such as a councillor or an MP. Also in September, we responded to 2 consultations on online gambling, one from the government regarding maximum stake limits, and one for the Gambling Commission on a range of issues such as direct marketing, remote game design, and identifying people at financial risk. Now, gambling is not an issue that affects all brain injury survivors, but some are more vulnerable to the risks associated with it due to the nature of their brain injury. And the impacts of brain injury that can make people more vulnerable to these risks includes impaired cognitive function, including reasoning, insight, and disinhibition. Some survivors also suffer from isolation, which can make them more likely to engage in risky online behaviours. And some survivors have received large financial settlements following their injury, which means they have access to large amounts of money, which could then be quickly lost through repeated gambling. Through our consultation responses, we've raised these issues with the government and the Gambling Commission so they can consider the needs of survivors when making legislative changes. And as Sarah has already mentioned, the government has recently announced changes to the work capability assessment. In October, we responded to the government's consultation on proposals to change some of the assessment's activities and descriptors. The assessment is undertaken to assess an individual's eligibility for some social security benefits. In the Health and Disability White Paper published in March this year, the government stated the assessment will be abolished in the future. However, in the meantime, they proposed changes to it, reasoning that because the work environment is changing, with more work from home and flexible jobs, more disabled people should be able to return to work. The proposed changes related to mobilising, continence, social engagement, getting about, and substantial risk. They would make it harder for individuals to be assessed as having limited capability for work or work-related activity. Headway's consultation submission robustly opposed the proposed changes. We understand that brain injury can have substantial negative impacts on a survivor's ability to mobilise, manage continence, engage with other people, and get about safely, and that all these impacts can affect a survivor's ability to work, whether in the home or outside it. However, we also understand that some survivors want and will be able to work after their brain injury, and we've continually campaigned for assessments to be undertaken by specialist assessors trained in understanding acquired brain injury. We now know that despite our efforts and those of other disability charities, the government is going ahead with some changes to the work capability assessment, which is due to be introduced in 2025. Headway will continue to advocate for brain injury survivors in the strongest possible terms regarding these changes.
Now, moving on to issues around concussion in sport, which has remained high on the media agenda this year with a focus on elite level sport. And just last week, over 200 former rugby players began their class action lawsuit in the High Court regarding what they describe as the systematic failure by the rugby governing bodies to protect players. It's encouraging to see that this issue has now been taken seriously in the world of professional sport, but of course, grassroots level sports people don't have access to the same standard of medical expertise when injuries occur during play. That's why in 2016, Headway launched its Concussion Aware campaign. We wanted to help people understand the signs of concussion and that taking an if in doubt, sit it out approach is the safest way to protect players from serious brain injury. So we were really pleased earlier this year that the government, in conjunction with the Sport and Recreation Alliance, produced official concussion guidelines for grassroots sports. Having a pan-sport approach in this way will help ensure concussion protocols are consistent across all sports, particularly across youth and grassroots sports. However, we would like the government to go further and commit to a public health education campaign to ensure participants in sport, and in the case of children, their parents, understand why the if in doubt, sit them out approach is so important.
We'd just like to mention a couple of broader health policy areas that are still under development. The past couple of years have seen the informal introduction of integrated care systems across England. Integrated care systems are an administrative structure for health and care and have replaced clinical commissioning groups. They're partnerships of health and care organisations that come together in a local area to plan and deliver health and care services. There are 42 systems across England, and each is led by a board. And the joining of health and care systems and their budgets is meant to see health and social care leads working together to deliver joined up services. In practice, we know that this can be a slow process and different systems are at different stages of development. Each system is meant to have a mechanism for involving the voluntary and community sector. However, we are hearing from our network across England that it can be hard to gain access to them, and health influencing and commissioning at local levels sometimes can be dependent on who you know or who shouts the loudest. Related to these systems, 2023 has been meant to see the gradual delegation of specialised services commissioning to these systems, ready for 2024-25. Specialised services are a diverse portfolio of around 150 services generally accessed by people living with rare or complex conditions, and these include services for people living with neurological conditions. In practice, it's hard to know how much of this delegation has taken place on the ground and how ready local areas are to take on the commissioning of such a complex area of work. We know that there have been delays to the transfer of responsibilities to several large systems. It will be important for ABI survivors that local systems get this right, as many of the services they need fall under specialised commissioning. And just also to mention social care funding. Despite the promises of successive governments, the issue of social care funding has been kicked down the road. This is important for brain injury survivors, particularly as many of them are of working age. Currently in England, anyone with assets of more than £23,250 must pay for their social care themselves. And below this threshold, contributions are made by the service user and the government on a sliding scale. Government action to address the pressures on social care has largely been pushed back. A white paper published in December 2021 announced reforms to address the catastrophic care costs that some individuals face in their lifetimes. But in the November 2022 autumn statement, the government announced that some of these reforms would be postponed until October 2025. And the publication of a next steps document in April 2023 saw many remaining measures from the white paper also cut back or cancelled. Many ABI survivors will need care across their lifetimes due to the impacts of their injuries, and many will need to contribute to their care costs. We hope that the next government will bring forward reforms that will make the funding of social care a fairer process. But there has been good news for brain injury survivors this year, in addition to the promise of the ABI strategy. A traumatic brain injury pathway has been developed and published, setting out what good treatment, care and support looks like for TBI survivors. The hope is that the pathway will be used by service providers and commissioners to review current practices against best practice care, from acute rehabilitation through to access to specialist community-based support provided by Headway groups across the UK. The document makes some important recommendations, including the introduction of specialist interdisciplinary TBI teams to be based in all major trauma centres and led by a brain injury consultant. In October, the National Institute for Clinical Excellence published updated guidance on rehabilitation following stroke. It aims to ensure that people are assessed for the common problems and conditions linked to stroke and get the care and therapy they need. It includes recommendations on the organisation and delivery of rehabilitation, both in the hospital and in the community. And more broadly, the Accelerated Social Care Fund, worth over £42 million, has just been launched in England by the Department of Health and Social Care. It will see local authorities working together to scale up innovative projects in adult social care and carer support over the next 2 years. The funding is not competitive, and every area that puts forward project proposals that meet the criteria will receive funding. and every area must put forward a proposal regarding support for unpaid carers, which we hope will be good news for the many carers of ABI survivors. The 3 objectives that the fund aims to meet are that people have choice, control and support to live independent lives, that people can access outstanding quality and tailored care and support, and that they find adult social care fair and accessible.
So the last couple of years post-pandemic have seen turbulent times for the Department for Health and Social Care, it's fair to say. Massive waiting lists, strikes across the health service and winter pressures greater than ever before. And they've also had 3 different health secretaries at the helm, all with different priorities. So it's kind of remarkable that any strategies have been worked on in that time at all, really. Whilst we reflect on the noteworthy changes in 2023, we must also look ahead to what will be a significant year next year. The government commitment to publish the ABI strategy could have far-reaching implications for brain injury survivors. And of course, there'll be a general election at some time next year. And whatever the result of that election, there are a significant number of MPs standing down. So Parliament will look quite different. And it's likely that there'll be a change of government as a result of that election. So we could see big changes in government policy on health, social care and social security. But we hope that there may be a little more stability in terms of personnel and longer term planning, which will be really helpful to us and those of you trying to influence and affect change for ABI survivors and their loved ones.